All right, so what do we actually do with this? So I don't want to talk about just the viral and the flu-like symptoms that we may have, where it's, if the things that I'm about to say are things that you would do leading up to and making sure that you didn't have a runaway problem with fluid retention or fluid buildup. We want to be able to get to those things right away. And also, when it's bacteria and viruses within a certain part of our body, we don't want those things collecting there. If you think about when you have head colds and when you have anything that happens with your sinuses and you're just feeling miserable, when you have a head cold, guess what? Your bacteria gets caught within the different interstitial spaces, and your sinuses, they're all connected. Within our technique for using tuning forks like this on the body, we focus on the interstitial spaces in the neck. We focus on the interstitial spaces all throughout the head, and it's all connected. We get this dam that happens right across the lower part of our neck that keeps a lot of our fluid caught on the from the neck up. And there's a huge amount of conditions involved in this, and one of them happens to be virus and bacteria and colds and flus and things like that. Well, guess what? Your throat is also located in your neck, and your neck actually causes a lot of fluid pressure problems, especially since the fact that we lay down on our neck and we compress our neck throughout the night. You would think that we were getting better, but again, laying down and compressing your neck makes things even worse, because we just keep all of the viruses and bacteria up in our head. One of our resolutions for that is we have a protocol that we use within our technique for on the body, working with weighted tuning fork, of getting rid of the fluid pressure within the neck and within the head, and we get all that fluid out of there so that the lymphatic system can work properly again, and that fluid really just gets moved out of the way into a larger area so those lymphatic vessels can actually take care of the load. We kind of diffuse everything outwards so that they're in another space. The vibration from the tuning forks can actually diffuse these pressure-filled spaces, fascial spaces. Vibration from the tuning forks, if done correctly, can actually move the fluid, the interstitial fluid, out of those spaces. And here's where it brings us up to our capability of working actually on the body. If you notice that in this picture, you can see the front side of the chest. So we were looking at the lungs themselves that are underneath the rib cage. And we have in between our ribs, there's a layer of muscle that you're not currently seeing, but you can see where the lungs are. The lungs are filling our rib cage, front and back, and that's an important thing to keep in mind here. So if you wanted to work with bronchial problems and you had bronchitis, asthma, things of that nature, don't forget that your bronchial tubes, your trachea first, your trachea moves down into the rib cage. So don't forget that there's that hole there just above the bone on your the center of your rib cage, in between your clavicles, that we still need to get the fluid out of there as well. And then our best access to our bronchial tubes leading down into our rib cage and down into our lungs is on the front side of our body. And we would want to get into the soft tissue in between our ribs. Putting the tuning fork on a rib, vibration-wise, the vibration is going to most likely stay within the bone. And what we want is vibration to get into the soft tissue and to the interstitial space so that that fluid can move out of whatever space it's inside of, and get it out of that space so it can move into another space that the lymphatic system can work. We're depressurizing our interstitial spaces, basically. And remember that there is a bag of fluid in between our rib cage and our lungs. That is where a lot of our problems are. When you have shortness of breath and breathing problems, and you're just coughing all the time and you're having all kinds of problems, a lot of your problems are not inside. Of course, yes, they could be on the inside of the alveoli, and you'll have fluid building up in there. But a lot of this problem is on the outside, and that's a big misunderstanding with these conditions that are basically respiratory or bronchial related. So if you're dealing with something bronchial related, like asthma or something like that, we want to deal with it on the front side. We want to get our tuning forks, we want to get vibration in there, we want to press down into our soft tissue in between those lungs, or excuse me, in between the ribs, so that we make sure that the fluid is no longer inside of these areas. Things are being freed up. You also have to consider the fact that what happens when somebody has inflammation in their bronchial tubes, or they have problems with their lungs. What is one of the first things that we do is we start coughing. All right, so the coughing is sounds like I'm saying coffee. We drink coffee. Well, of course, but that's not what I'm saying. We start coughing, and that is actually something that continues to cause even greater problems. And sometimes we have symptoms that we think are related to the disease itself or the condition itself, and it may have just been that you have coughed so much that you've added more inflammation, but you also added a physical insult to the interstitial space on the outside of our rib cage. So you're not seeing in this picture, you're not seeing the superficial space that I was just talking about. This same stuff that I'm talking, that's on our arms and everywhere in our body, just underneath our outer layer of skin, is an interstitial space, and it's probably one of the biggest things that ends up getting way too much fluid. Well, what about on our rib cage here? All throughout our rib cage, we start coughing and coughing and coughing, and that puts more of that excess fluid on the outside of our rib cage too. And that just makes it worse. You have to consider that when you start pressurizing a space with fluid, and then you have, let's say this hand right here is bone, so it doesn't move very well. And then my hand right here is a fluid-filled space, filled with way too much interstitial fluid. And I'm coughing, and all I'm doing is rubbing that interstitial fluid-filled space up against this hard bone. And that's happening on the outside of our rib cage as well. We have movement against bone. When any interstitial space or any of our superficial outer layerings move back and forth rapidly and get pressurized from our bones, we see problems there as well. We see this all the time in NEHC, where even in areas in our face, we have problems here, we have problems underneath here. Everywhere where there's a bone that moves back and forth, we start to have collection of fluid there that stays compressed in those compartments for very long periods of time. And all right, so consider that fact. Consider when you're working on somebody that has a viral infection, that has the flu, that has bronchitis, anything that would be forward of your lungs. If they're coughing a lot, if you feel in the soft tissue, you're going to feel a lot of bumps and things going on here. That's probably cough related. And there's fluid in there. Guess what? It's the same exact fluid. It's just on the outside of the rib cage now. So that still continues to have the problem. When you have a tightness of chest, that could be on the inside, but it could also be on the outside as well. We want to take, let's say it's an asthma attack or something like that. We're going to want to make sure, first of all, that we get the interstitial space, that we put our tuning forks on this on the outside of our skin. We're basically pressing down on our skin. And then we also have to be considering the fact that our bronchial tubes are having problems as well. And where I was showing you earlier, where the sternum comes up to here, and then I have my clavicle on both sides coming to an end. There's a hole right here as well. And if you feel on somebody that has asthma quite often and has asthma attacks, I guarantee that you probably are not going to be able to press down too much into this hole. and feel around in a person that has normal respiration and doesn't have bronchial problems, they're probably going to be able to press down quite deep into here, where you can feel your, if it's a man, you can probably feel the Adam's apple, and just underneath the Adam's apple, you should be able to press down quite a bit into there. That's part of your interstitial space as well. And we can actually strike our tuning fork and we can put it into that space. And we can actually press down quite a bit, but we don't necessarily have to. We can press down just as much and kind of angle it around the bone. I'm not touching the bone. Well, I'm kind of up against the bone, but I'm not on the bone itself. That's one of the things that when you deal with vibration, you want to make sure you're not on the bone, because again, the bone actually takes most of that vibration. It gets caught inside the bone and it will transfer it down the bone. You want to get the vibration past the bone. And so we're just going to put our tuning fork right inside that hole. I'm doing it at an angle facing this way, and then I can strike it again. I can put it at an angle facing this way, and I basically do it all 4 directions. And I'm pressing in quite a bit. And then you should feel immediate, if you're having an asthma attack, you start to be, the person should start to be breathing a little bit better now. If you focus on this first, that would probably be the immediate relief for an asthma attack. Pressing right down inside of that hole and kind of going down at an angle, and then to the side, pressing inside the hole, pressing right up against, so that the stem of the tuning fork is pressed against the bone like this, and then just keep doing that around that hole. Then if you needed to, you can run up the side of the bronchioles, not right on it, but right up the side like this. And notice how I'm using my shirt. I have a cloth in between the tuning fork because this tuning fork has a little divot right here. So when you start pressing against it, it could end up scratching the person. I do not recommend putting any extension on this, because extensions actually start to dampen the results of the tuning fork. So you want to make sure that it's barefoot like this. This tuning fork happens to be a 128 hertz weighted tuning fork. And then don't forget about the outside. We want soft tissue to be taken care of. We feel for bumps and fluid, things like that. We can run our tuning fork and put it on this area, strike it, press down against the soft tissue. If you can, on this first one, don't worry so much about the rib cage and getting it through the rib cage. You want to work with the very top part of it. If you need to, you find that there's a lot of fluid buildup, you can actually put your hand, or have somebody put their hand on and press down and move very slowly in this direction towards the sternum. And I'm pressing inwards and just kind of letting my fingers do a nice slow move towards the sternum. What that's doing is using physical force, very much like a physiotherapist would do, and is moving some of that fluid over longer distances. Doing that without the vibration for very bad conditions probably wouldn't be enough. It takes vibration and stretching of the skin or the fascia and the tissue underneath it, and pushing. We're pushing fluids into a different space. We're getting it out of this pressurized space. Is there anything else that you saw there that you wanted me to add? All right, so to recap on the front part of the body, this working right in this area with the tuning forks, that's going to be your first rapid response for an asthma attack, and it should be able to stop an asthma attack immediately. This is something that we've done many times within our healing center. Just make sure that you're clearing out this area right here, this hole that you have. Making sure that you don't press down too much, but you want to press down far enough. And by the way, if you're going to press down enough, you're not going to be putting your fingers on the stem. You're going to be grasping it up here, right here on the meaty part. This is where we grasp our tuning fork, just like this. And when we're grasping it, we're striking it, we have enough hand hold to push up, to push right into that hole, and then to kind of come down at an angle. That's going to get rid of a lot of that fluid that is on the outside of your bronchioles. But remember also that you are pressing against the bronchial tube, and it's also going to release some of that fluid that's on the inside. You know, the asthma attack means your bronchial tubes on the inside is starting to get inflamed, and you have you have more restriction of the tube on the inside. The same thing is going to happen on the inside of it as well, but I guarantee that it's a combination of outside of the tube and the inside of the tube, probably more so on the outside. The same thing happens when the bronchial tubes run into the lungs. The same thing occurs with the pleural cavity outside of the lungs, then the rib cage, then the outside of the rib cage. These things that I just talked to you about here. Anything that you have where you have a cold or you have any bronchial related problems, you want to get rid of the stuff that's on the outside of the rib cage. You want to put your tuning forks in between the ribs. And probably what you'll start to feel here, if the pleural cavity starts to push out quite a bit, if you feel your ribs here, you probably will feel each individual rib. Let's say each finger is a rib. You will most likely feel in between these two fingers, or in between the two ribs, you probably feel it's almost like a pencil underneath the skin. That is everything pushing out in between, all that fluid pushing out in between those ribs. And you want to get that fluid away from that area as well. And I have one more to show you here, and it's going to be the picture of the backside. So you have to consider on the backside, this would be for better access to the lobes of your lungs. So if you got problems on the inside of your lungs, like pneumonia, or you have problems on the outside of our lungs or your lungs, whether it's COPD or something like that, you want to, again, make sure that when you're pressing down the tuning fork on the person's back, so now they're either sitting, it would be better if they were laying down, but chances of a person laying down with COPD right away could be pretty slim, but we've done it. And you actually get very, very quick response from the ability for a person to take a breath, probably within just a couple strikes, and putting the tuning fork up against the backside of the lungs provides very, very rapid release. And within just a couple minutes, a person with COPD or problems with their inner airway in the lungs and pressure on the outside of the lungs, you'll start to relieve that very, very rapidly to where the person could possibly take a breath. Within typical sessions, if a person has come in and they have oxygen, they're on oxygen, then we've had results like that where by the time this person leaves that one session of, let's say, 45 minutes, they're leaving without oxygen as they walk out. I can't speak for how long that happens and whether something's going to come back within a certain day or two, or how many sessions that involve. That's really going to be dependent on the situation and the person. But we have very, very positive results when it comes to especially things like COPD. And we haven't had that many people personally within our New Earth Healing Center here in Michigan with pneumonia, but those that we have had pneumonia and even things that have happened bronchial-wise, those things have been relieved very, very rapidly. Then it's also going to depend on how long this person has been filling up with fluid. If it's very, very critical, then you know, they would probably still need medical attention. So it's totally up to you whether you want to use the tuning forks or use methods like this to make sure that you're keeping the fluid away and from progressing. And if you can get to it early enough that when the symptoms start happening where you have flu-like symptoms and you start feeling that the things that are happening in your bronchioles and in your chest, you can use these vibrational techniques to make sure that that fluid stays away from here, because the more you can keep the fluid pressure away, the better the lymphatic and your immune system can actually operate, and we can get that virus and the bacteria inside of our lymphatic system and Again, if it's a virus that is causing damage to cells, we want to get the cellular debris into our lymphatic system as well. And then this picture is one of the studies and research that we did on our own with the tuning forks. And one of the things that we know about what the tuning forks do that may be different from other techniques you may use is the ability to have fluid diffuse through fascial layers. Since we're bags within bags and layers within layers, the fluid that shouldn't be in a space, once it's overpressurized, needs to get out somehow. Why the tuning forks work so well is the ability to diffuse fluid through layers when you have a tuning fork pressing against the layer and you have vibration. What you're seeing on the screen is a very zoomed in picture. We took a endoscope, 2000 times zoom, and this was actually up against, on the left hand side, the tissue is actually from a cow that it was actually an experiment that we did, that the tissue that we had was very fresh tissue, and so it still had interstitial fluid with it. And you're looking at one of the outer layers, and this tissue would be the fascial sheet that separates your deep superficial fat layer, adipose layer, and the first layer of muscle. So what you get from a steak from the store is actually just on the other side of this fascial sheet. You usually don't see that particular fascial layer. It's very thick, and fluid has a difficult time moving through that layer. Once it gets onto the other side of that layer, then there's actually these very long highways of fluid movement. We can actually move fluid all the way from when it gets into a certain fascial layer, we can actually move fluid all the way from your feet, probably all the way up the entire distance of your body through these fascial freeways. And they're in between fascial layers that are designed to move back and forth across each other, so that we have still lubrication and things like that for movement, musculoskeletal movement. And what we were able to determine even through video is that when you strike the tuning fork, you put them against these fascial layers, the interstitial fluid on the other side of the layer can actually diffuse through the layer. We believe that the mechanism at play is those fascial fibers in that fascial layer are actually the ionic bonds in between the fascial layer can actually separate enough to let that fluid diffuse through. We believe that it can happen for endothelial layers, things like that. So, all right, so this is part of our vibrating tuning fork and why we think that the methods that we use at NEHC and we teach in our academy are very useful. And using a weighted tuning fork pressing against the skin is very useful for helping your immune system do what it needs to do, especially in times of crisis with viral and bacterial crisis like this. And if you want to know more, you can visit our website at nehcacademy.com. I'll make sure in the notes of this video that you can have links to that, and our Facebook group called NEHC Academy. And you see the logos for both of our techniques that we use. On the left is vibrational fascia release technique, VFRT. That's where we have the weighted tuning forks. We have paid training on our website. So if you wanted training in that technique, then you can see more information on our website about that. On the right hand side is vibrational chronotherapy. That's using unweighted tuning forks. And currently we have free training in the unweighted tuning forks available on our website.